In my office, which is on South Main Street, part of Akron Children's Hospital. And fortunately at that time in the morning, about 11 o'clock, I fortunately didn't have a patient at the time. And I noticed outside my window where there are some tables where people could sit to eat lunch, there was a man and woman sitting out there talking. Couldn't quite make out what they said, but they were talking for a little while, and all of a sudden there was this like loud thump.
My partner, Officer Kent Shively, we patrol Main Street as beat officers. We're walking southbound just past Cedar Street. We're talking to each other, observing the traffic and the surroundings around us. Next thing we hear, we're in front of the AES building, which is in front of the Children's Hospital Psychological office. We hear some yelling and everything, and I look at my partner and said, "What's going on?" So we proceeded to walk over. We never run into a situation. We don't know what we're getting into.
Pretty much when I went out the door, and at the same time I could see two police officers in the street coming up toward the stairs, toward the area, Officer Strainer being one of those.
I told my partner, Officer Shively, I said, "Hey, call for EMS," even though they might have called already, but usually on our radio we can get them to respond a little bit quicker.
So then we both approached the victim, who was on the ground next to the table, and started sort of our procedure for resuscitation, trying to detect a pulse, which he didn't have one, and so we got him set up to do chest compressions. I think we might have done some ventilations, a couple of ventilations, but mostly focused on chest compressions, and didn't respond. And I think at that point I left to go into the building to retrieve the AED.
I did not see you go for the AED at that time. I just noticed it showed up right there and we put it together. It's pretty self-explanatory. You open it up and it starts giving you instructions. It'll talk and it'll have the two pads that you have to use above the heart and below the heart, and they actually have pictures to show you where to put them on there. And you just attach that to the chest and you put the probes onto there, the electrical connections right there. You turn it on, it measures for a pulse, and it tells you exactly what to do. I mean, most anybody could use it. Now we've had training in them, and even with the training, it's still, you know, you're a little hesitant, you don't know, but it says stay clear, and it checks, okay, administer the shock. Well, you actually got to push the button to administer the shock, and it does it, then it monitors it. It's self-explanatory. Put it on the gentleman's chest, we administered the shock, then we felt for a pulse, and it said, the machine would say, continue CPR, so we continued CPR. It seemed like for a long time we were just doing CPR, and at that time finally EMS shows up, Akron Fire Department, and they take over the scene.
As medical staff members of Akron Children's Hospital, we were required to be basic life support certified, which is every 2 years, and I just had my training in December of 16, so I was like 1 year into my 2-year certification. Never had to use it actually in sort of real life, just in a simulation center for training. So
his office staff did tremendous work with the sister. I mean, they took care of her, calling for numbers for her, just to get her calmed down. They did an excellent job.
Just try to remember what the training taught me and go forward. Because as a psychiatrist, I don't have life-threatening situations that occur. I mean, every once in a while some patient will get angry or yell or scream, but it's never a sort of a life-threatening situation. But yeah, this was different. I think anybody especially had the training, and especially whether they were in law enforcement or the healthcare professions, would have done it. You know, I could see where just a normal bystander who had no training in that would be at a loss maybe what to do. But you know, if you're trained for that situation, then you respond appropriately.
The value of earning CPR is you may save someone's life. You know, once someone's passed away, that's it. So you know, you have someone's life in your hands, and it could be a stranger, it could be a loved one, it could be anybody, and it saves people's lives. That's why you need to know CPR.
So I would agree. I mean, there is that chance that what you do could save their life. So it's important to be trained so that you can go into the correct procedure and administer it appropriately and give that person the best chance they have of survival.